a topic that's gained prominence during the COVID crisis, but is certainly not a new topic. It's been a subject that has garnered much research both in the Northeast and across the UK and internationally. And it's really an honour that I can chair this morning and bring this important topic to everyone's attention, and an opportunity to discuss how we can take the research agenda forward, particularly working with our practice partners. And the event, of course, has a hashtag. The hashtag is Fuse QRM. Please feel free to use the hashtag. Just before I introduce Rachel, I'm going to run through a few housekeeping slides. Steph, would you mind putting onto the next screen? So throughout this, everybody, I'm sure, is familiar with all of these rules of engagement. If you could please keep your microphone muted unless you're invited to speak. Please stop your own video. We have a lot of people on this call. So in order to help with the streaming quality, it's a lot easier. we don't look at ourselves. But please feel free to start it during the social. The presentation and the question and answer sessions, you can type your questions into the chat box. I'll be manning that, and I'll be putting the questions to our speakers. In the social, if you'd like to speak, type a question mark into the chat box or raise your hand. It might be easier to do the question mark, seeing as there's so many people on the call. If you feel anybody is behaving inappropriately, please message Ruth Wilson, who's our host. And we are looking forward to enjoying a professional session, but do let us know if you feel that there are any issues. Okay, program-wise, we're running very slightly late, but not too bad. I'm going to introduce our first speaker, who's joining us from London, and that is Rachel Loopstra from King's College London. We then have a policy practice perspective from Neil Munslow from Newcastle City Council, then a series of bite-sized presentations from a lot of names that'll be very familiar to those of you from the Northeast, and then we move into our question and answer session. So without much further ado, could I please pass over to Rachel to begin her keynote. So just while Rachel's setting up her slides, Rachel has been working in this area for many years and particularly busy throughout the COVID period. And it's a real pleasure to have Rachel come and speak to us. Thank you, Rachel. I'll pass over to you.
That's great. Thanks very much, Amelia, for the introduction, and good morning, everyone. Many thanks to Steph and the Fuse team for inviting me to speak this morning. So as Amelia mentioned, I've been working on analysing mostly quantitative data related to food insecurity during COVID-19, but also have been engaged in research in this area for a number of years now in the UK. But I'll be, of course, focusing on COVID-19 this morning. So as Amelia mentioned already, I think it's important to reflect on the fact that this problem is not new during COVID-19. So what did we know about this problem before? So the Food Standards Agency began using the USDA's food security survey module in their Food and You survey in 2016. It's of note that this only covers England, Wales and Northern Ireland, so it doesn't include Scotland, and Scotland has been using their own measures since 2017. But based on this nationally representative survey, 20% of adults were found to be experiencing at least some level of food insecurity in 2018. And I highlight these different levels of food insecurity because later on you'll see that what we've been tracking over the COVID-19 crisis has really been more moderate and severe levels of food insecurity. But 10% of adults indicated at least 1 or 2 experiences of marginal food insecurity in 2018. So that they worried about their food running out before they would have money to buy more, that they experienced their food supplies not lasting, or that they were unable to eat balanced meals because they didn't have enough money for food. And then a further almost 6% experienced moderate food insecurity, indicated by things like skipping meals, eating less than they felt they should. And then almost 4% experience more severe levels. So that is measured by things like not eating enough food, experiencing hunger but being unable to eat, and then most severe, going whole days without eating. So this problem isn't new. It's been widely prevalent. And what I think is important to highlight here is just how many people were in this marginal category. So although maybe not experiencing more extreme manifestations of food insecurity of actually going without food, many people lived close to that line before COVID-19. Analyses have showed that some groups are much more likely to experience elevated rates of food insecurity. So this include households with children, groups that identify as one ethnicity in the BAME category, people with disabilities, people who are unemployed, those with the lowest incomes, and also tends to be higher prevalence rates amongst younger age groups. And these are all groups that were particularly at higher risk of more marginal levels of food insecurity. And then what I'm highlighting on the right-hand side are the groups that really stand out as experiencing more severe levels. So this is people with severe disabilities, people who are unemployed, and people with the lowest levels of income. Those are really the strongest predictors of more severe food insecurity. But all the groups listed on the left are those experience or more likely to experience marginal levels. Again, this is all pre-COVID. So food insecurity under COVID-19, well, what changed? So although I maybe didn't indicate it clearly, the way we've been measuring food insecurity, the way that's been done in the US for a long period of time, and then the measure adopted in the UK, has been food insecurity tied to financial resource constraints. So people indicating that they don't have enough money for food. And this is because, you know, for most people, this is their main food acquisition strategy, is going to the shop and buying food. And also, it's been thought that, you know, even if you have problems of physical access to food, that if you have the financial means, you can usually overcome any issues of physical inaccessibility to food. However, under COVID-19, this changed. So yes, economic access was still impacting people's access to food, and new income losses, people working fewer hours, being furloughed, losing employment altogether, having to self-isolate and not being able to go into work, meant that people were losing income and therefore could be experiencing new compromised financial access to food. But then there were also this large rise in issues of physical access to food. So people who are extremely clinically vulnerable being advised not to go out for any reason, including for the purchase of food, but also just people at moderate risk, so not just in that extreme group, also being told to stay at home as much as possible. And in general, I think people were just afraid to go out for food. And again, we're advised to go out as little as possible. So suddenly we had this issue of people not being able to access food the way that they normally would from shops. Then there was the issues of availability in shops themselves, so food not being as readily available, especially in the first weeks of lockdown through the end of March and into April. There's also, of course, the closure of institutional food locations, so children not accessing free school meals in the first weeks of the crisis, closure of other food outlets like cafes and restaurants, and then also some non-retail suppliers such as food banks and meal programs, things like that. Issues of stability on household food supplies, and then also impacts on utilization. So the types of food that people could access were not necessarily matched to their cultural and health needs. So many things changed in terms of, or could have been influencing then people's food security over COVID-19. And we needed, or what we wanted to do in analyzing this problem over the course of the crisis was capture these experiences as well. So not only did we have to consider financial reasons, but we also had to consider other reasons for people not being able to access food over this time. So I've been working closely with the Food Foundation to monitor food insecurity over this time, and they've been able to do polls through YouGov, which is a national polling agency. And we've put together surveys where we were measuring food insecurity from the beginning of April to the end of August. And that's the data I'm going to be sharing with you today. Because of the constraints on the questionnaire length, we could only include 3 questions from the USDA food security module. So it's not the whole module that's been on the Food and You survey. And we chose to focus on questions that are capturing more moderate or severe levels of food insecurity. So people saying that they went with less food, that they experienced hunger, or that they had even gone eating without a whole day. So what I'm not capturing here are those more marginal levels of food insecurity. And then we ran this YouGov poll over 4 different survey waves. So first early on in April, in mid-May, and in early July, and then at the very end of August. So YouGov polls, just briefly to highlight some differences from the Food and You survey, which is a door-to-door survey of about 3,500 adults. The YouGov polls draw from a panel of essentially members who they then, when people participate in the survey, they weight the sample to reflect the socio-demographics of the UK population. So in each wave, we had about 4,300 adults completing it, except in late August, where the survey wave was boosted to particularly focus or enable a greater subsample of families with children. And the questionnaires included questions about current employment status, but also how it changed from February in one of the waves, and I'll be sharing some of that data. Whether or not people were self-isolating since March, indicating or reflecting the guidance for people to shield, or just for a short period because they had experienced symptoms or been exposed to someone with symptoms. We also asked questions about losses of income due to COVID-19, and then also socio-demographic characteristics. So the analyses I'm going to be sharing with you today are looking at how the probability of food insecurity has changed, comparing the YouGov polling data to the Food and You data. And I'm using a pooled sample of 2016 and 18 data to increase the power that I had to look at subgroups. So I have adjusted these analyses for socio-demographic characteristics to bring the 2 surveys closer together in characteristics, but also then testing for interactions. So testing whether or not there have been some groups that have been particularly impacted by increasing food insecurity over this period compared to others. And then the other bit of analysis I'm hoping to share, if I have time today, is looking at some groups that might be particularly vulnerable for medical reasons, so those who are self-isolating over this period, and then also how food insecurity changed for people who moved into unemployment or furlough over this period. So first of all, how did the prevalence of food insecurity change from 2016-18? Well, there are a couple things to consider. So I'm going to caveat the next graph that I'm going to be showing you. And that is that the Food and You survey includes the standard USDA scale, which always asks people about their experiences of food insecurity in the past 12 months. So something like, in the past 12 months, have you ever experienced hunger but been unable to eat? So at any point in that 12 months, if someone experienced that, they indicate that that happened. In the Food and You, in the YouGov polls, we were only asking for shorter recall periods because we specifically wanted to focus on what was happening during COVID-19 and for the periods not to overlap with one another, so we could track changes over the different survey waves. But what we know from data from the United States, where they ask people to recall any experience in the past 12 months, but also experiences in just the past 30 days, is that when people are answering the questions for a shorter period of time, the prevalence of food insecurity is reduced by about half. And this is because food insecurity is not always a chronic problem for people. It can relate to fluctuating incomes, different experiences over the past year in people's lives. So one thing to reflect on in all of the data that I'll be showing you is the 2016-18 data is from the past 12 months. If we were to adjust it for a 30-day recall period using what we see in the United States, we would expect it to be only about half of what we're seeing. So already the comparison that I'm drawing to the 2016-18 data is actually biased to not show the true prevalence if the 30-day recall period would have reduced the prevalence of food insecurity in 2016-18. The other thing to reflect on is that the YouGov data is a panel survey versus a face-to-face survey, which was done in 2016-18. And so there are questions about whether or not how that would influence people's report of experiences of food insecurity. Are people more or less likely to share their experiences if it's an online survey? Probably we would think that they might be more inclined to share experiences if they're not speaking to someone face-to-face. However, the other thing about the YouGov sample is that you need to be linked in, have access to the internet and have a certain amount of tech savviness to be able to participate in their surveys. So this also might mean that just because of who the YouGov panel includes, the set of members that they draw their samples from, that this is a more privileged sample than we would expect from just going door to door as was done in the Food and You survey. Also, and these are characteristics that essentially we can't adjust our analysis for. So we can't know who in our YouGov survey, or they're just excluded altogether, people who are digitally excluded. So the first graph I wanted to show you is what the probability of food insecurity looked like then comparing to the Food and You data. So on the far left, you're seeing the prevalence of food insecurity just based on the 3 questions that we asked in the YouGov sample. So we just pulled out the prevalence of food insecurity based on those 3 questions. And then you're looking at what that prevalence looked like in early April. And these figures are adjusted for gender, age, marital status, number of children, and the region that people were living in. So an extreme rise in food insecurity based on these 3 experiences of food insecurity or measured experiences from Food and You to early April. And then we did see quite a rapid decline to mid-May, but then a fairly leveling out where the prevalence really hasn't dropped back to what we were seeing in 2016-18. So still quite elevated even in late August, which you'll remember at that time a lot of people had returned to work, but certainly things were not back to what they had been. Early analysis that we did of just the very first wave of the YouGov data, where we captured different reasons for food insecurity. So the questions that we asked about food insecurity were followed up by questions about whether or not people had had those experiences because of a lack of food in shops, because of financial reasons, because they were unable to go out for food, or for more than one of the above. So here, what we saw in early April was that amongst people who were food insecure, almost 40% of them indicated that this was just due to a lack of food in shops alone. And I think this relates to, again, that marginal food insecurity level that I highlighted from 2016-18. It's just how close people were to experiencing going without food even before the crisis, and suddenly you layer on real difficulties in accessing food, and that had an immediate impact then on how able people were to access food during this time. So that initial drop in food insecurity that we saw from April to early May then, I think was mostly explained by the recovery of food retailers where foods were more readily available in shops over this time. But showed certainly that the food supply issues were a key vulnerability then for people in early lockdown. This early report also highlighted different characteristics that were associated with food insecurity, but you'll see from this list that largely they mirrored who we were seeing was at risk of food insecurity before COVID-19. But what I've done in the next set of analysis is then look at, well, yes, although we're seeing that these people who tended to be more or less vulnerable before COVID-19, were any of them particularly more likely to experience increases in food insecurity than others? And I focused my analysis on 3 groups of potential concern, so younger age groups, households with children, and then also people from BAME communities. So the question then, has food insecurity worsened for some groups more than others over the pandemic? So the first group I wanted to highlight has been the prevalence of food insecurity amongst BAME groups. So here we see that across the whole population, again, there was this large rise in early April, but amongst people who are identifying as one of the Black, Asian, or minority ethnicities, we haven't seen the same decline over the period to late August, where they're remaining at significantly higher risk of food insecurity compared to individuals who are identifying as having a white ethnicity. So that's suggesting then that the recovery hasn't been equal, and in fact that COVID-19 has increased inequality in experiences of food insecurity between these 2 groups. The other group that we were looking at was households with children, and we've been particularly concerned about households, larger households, because of how they've been affected by the benefit cap and also not eligible for child benefit. So here we can see that even before the crisis, there was elevated risk of food insecurity amongst larger households. But again, that the risk of food insecurity seems to have increased more for them. But then importantly, at the end of the survey period that we're looking at, that there's more spread and prevalence of food insecurity with households with 3 or more children now having significantly higher risk of food insecurity than households with fewer children or no households without children at all. So again, it seems that the COVID-19 crisis has led to households with 3 or more children having much higher prevalence of food insecurity than other households. So again, widening inequalities for these households. And then the last group I wanted to highlight was how food insecurity has changed for people by age group. So again, all age groups experiencing a rise to early April, but the recovery of food insecurity has been much faster for people in the oldest age group, where we see levels essentially returning to what they had been to before the crisis. But then the youngest age groups having still significantly higher rates of food insecurity than they had before the crisis. So again, suggesting unequal recovery or essentially no recovery at all for the younger age groups, with much higher rates of food insecurity evident for them. The next set of analyses goes through 2 other groups that we were concerned were particularly vulnerable to food insecurity over the crisis. So those who were having to self-isolate, and then also people who lost their jobs. And indeed, in the first report that we put out in April, it showed that these new groups at risk of food insecurity, even after adjusting for other socioeconomic risk factors, were those who were self-isolating and people who reported losing their income due to COVID-19. But because of how interventions were rolled out over April, we were curious then to look at, well, did risks of food insecurity change for people who were shielding or self-isolating, given the interventions that were rolled out over this period? And then similarly, furlough was rolled out in early April, and also help for people who were self-employed was rolled out into May. So did risks of food insecurity change for these groups over this time? Was there evidence of potential impacts of these interventions? So first, looking at how food insecurity changed for people who were self-isolating, Well, some of the interventions that we know that were rolled out over this period were the National Food Box Scheme. I've also been doing work connected to this wider research project looking at how local authorities engaged in support for people who are shielding but also unable to go out for other reasons. And there's been an immense amount of action from local authorities and local organizations over this period who also were helping support people who could not go out for food for shielding or self-isolating reasons. And all of these responses were really rolled out over April and in so a couple of weeks into the lockdown. And these just highlight kind of the variety of different schemes that we saw, including giving access to food retailers for people who are shielding, and then also actions for people who were unable to go out for other reasons. So the one example being the volunteer responder program, where people could have help with their shopping. So what we saw from the data was that there was a large increase in people reporting that they were receiving home food deliveries, particularly amongst groups that were shielding and self-isolating. So it did appear that more people were able to access home food delivery over this period. And then also more people in the shielding and self-isolating group also reported receiving food parcels from April to May. So again, suggesting that these types of responses were to some extent reaching people who are shielding and self-isolating. However, I'll just note the prevalence level here. We're talking about a prevalence of 3% of people who are shielding and self-isolating, rising to about 7%. So the reach was by no means, the whole group being covered by this kind of activity. But correspondingly then, when we looked at the prevalence of people who were of food insecurity amongst people who were self-isolating, there was this sharp decline from April to May. However, you note that it is actually quite parallel here, so it doesn't appear that that these responses were having an effect over and above the effect of what was just maybe seen available to everyone with the recovery of retail. And then also important to note here is how this risk of food insecurity remained elevated to this third survey wave. So this is into July. This graph just highlights that there was, amongst people who were self-isolating and shielding, there was a significant drop amongst those who indicated food insecurity just due to food access issues, and also a drop of people indicating food insecurity due to an inability to go out. And so it suggested that this drop here, which we didn't see to the same extent for people who are not self-isolating, that the drop in food insecurity was due to recovery for that reason as well. One thing to note from this analysis was that when we looked at people who were self-isolating for 7 to 14 days, there was no evidence of recovery moving from early lockdown to May and July, which is pooled in the last survey wave here, which suggested that there wasn't the same deliberate actions to address food insecurity amongst people who are self-isolating over this period. And I think that has been a concern throughout the crisis, is how a lack of support for people told to self-isolate for 7 to 14 days has essentially undermined that public health advice, because they weren't given quickly enough the financial support they needed or food support they needed to enable them to stay home and self-isolate. Lastly, is new unemployment driving rising food insecurity, and is there evidence that the furlough scheme has been protective? So a number of different schemes rolled out over this period. For the sake of time, I won't go into detail of them, but actions taken specifically to address the potential risk of food insecurity arising for groups impacted financially over the crisis. So this graph is looking at the probability of food insecurity by people's employment status compared to what they reported their employment status was in February. So we asked this question just in the May and July waves of the YouGov surveys, and they're pooled together in this analysis. So what you're seeing on the far left is the prevalence of food insecurity for people who remained in employment from February. Then the next bar in is the food insecurity level of people who were newly unemployed, but they had been unemployed in February. So what you're seeing is an incredibly large jump in food insecurity for this group. So suggesting that new unemployment is absolutely contributing to rising food insecurity over this period. Then importantly, although the group on furlough hasn't seen the same rise in food insecurity, it has been significant for people on furlough over this time. And the furlough scheme has only provided 80% of people's wages over this time. And there's been concerns raised by many groups that particularly for low-income people, having a cut in 20% of your income is obviously going to impact your ability to afford basic essentials. And so this data seems to be suggesting that whilst yes, they haven't experienced the same rise in food insecurity as they would have done if they had moved into unemployment, there's still a group that's been experiencing elevated levels of food insecurity over this period. So just to wrap up then, and I hope I'm not too over time, summary of the findings. Certainly we saw early impacts that were very dramatic in April, and I think this reflects how precarious access to food has been in the UK, with this kind of immediate shock having an impact on people's ability to access food very quickly in the crisis. There was evidence of some recovery with food retail and delivery schemes potentially contributing to that, particularly for people who were shielding or not going out to purchase food. However, problems persisted into August, particularly for some groups, so the newly unemployed and also people on furlough being more likely to experience food insecurity over this period. And then, as I highlighted, some groups have been more vulnerable to persistently higher levels of food insecurity and no evidence of recovery. So families with 3 or more children, people from BAME groups, and then also younger age groups. Just like to thank my collaborators and the funding towards this work, and I'll turn it back over to Amelia. Thank you.
Thank you very much, Rachel, and that was absolutely fascinating. I couldn't bear to stop it because it was such an interesting report. I'm passing over to Neil Munslow from Newcastle City Council, and just while Neil is getting his slides up, it's I can see Neil there. That's great. Your video is working. Just waiting for your slides, Neil, when you're ready. So
we're not doing slides.
Are you not doing slides?
Just provide a verbal response. So
fantastic. That's great. That's brilliant, Neil. I'll pass over to you. Thank you.
Thanks. So, hello, I'm Neil Munslow. I'm Service Manager for what we call Active Inclusion at Newcastle City Council. And Active Inclusion has been our response since 2013 to the challenges of the welfare reforms, which resulted in a reduction in around £120 million worth of benefits a year from Newcastle residents. Austerity, which has resulted in around £337 million less budget to respond to those challenges, increased by about 32 million since the start of the pandemic, and the Localism Act, which basically pushed a lot of those challenges to local authorities. And our response has been to try and develop more integrated responses about trying to provide residents with a stable life, somewhere to live, an income, financial inclusion and employment. And obviously broadly agree with everything that Rachel showed in her presentation. And we see those things acting out locally. And I think our challenge is always, what can we do, particularly what's the role of the local state as the national state withdraws? And the pandemic obviously exacerbated the challenges that more vulnerable residents face. And I think, I suppose, confirming really a lot of what Rachel said there. Our challenge was to quickly change and respond from a welfare safety net type model to one that was more proactive, going to people rather than waiting for people to come to us and stand in line. And we saw some really positive examples of that. The West End Food Bank in Newcastle gave out 4,873 parcels in May 2020, a 250% increase. And that was a kind of heroic and Herculean effort of finding people who could drive, take food to people. And those networks, and the council had its own city lifeline. We increased our crisis support, but it did also highlight that gap between what's the role of the local authority, or local government and national government. And we really welcome working with academics. We've had some really positive experiences working with Newcastle University, Northumbria, Heriot Watt recently. And I think our challenge, envious of Rachel's data, and it's how we can try and translate that learning into real-time data and real systems, so that our responses to people in crisis happen in real time rather than retrospectively. And poverty and food poverty isn't something we can wait for a long time to respond to. So in Newcastle, we've tried to develop a more place-based approach, what's right for Newcastle, rather than necessarily following a one-size-fits-all national agenda. Obviously, we would like to see structural changes that meant there wasn't such an extent of food poverty, but those things aren't in the control of a local authority. So we have to respond to our primary roles, which is about trying to build resilience and manage and reduce the need for safeguarding, but to respond to it when safeguarding is required. So we've tried to become more proactive, like using opportunities like debt, because with the £120 million that was reduction in welfare benefits, that originally the government's intention was it would be replaced with work. Work hasn't replaced the loss of benefits. It's been replaced by predominantly by debt, forbearance, and the massive increase in food bank use. So we've seen huge numbers, around 32,000 households, I think, last year, using the West End Food Bank. And so changing our approach, that rather than seeking to collect, we seek to connect with residents, using those opportunities. But it is also a challenge in creating new infrastructure so that we can have the data system, so that we can better and more proactively connect with people when they face these challenges. That's not to say that we can solve all of those residents' problems. We can't raise sufficient tax in order to replace the income that they've lost, but we can change our culture so that we can help to mitigate those challenges. And we can change our culture to try and move away from only having a safety net model where people respond to us when they're in crisis, to understanding their circumstances. And I think a lot of the things in Rachel's presentation, there are indicators and categories we know that people are more likely to be at greater risk. We don't always have access to that information. There isn't, for example, on unemployment, there isn't real-time data sharing between the DWP and local authorities, but we do have information around council tax arrears, we have information around social care interventions, we have information around rent arrears, and that allows us to start to develop more preventative and proactive responses. And I suppose finally to say something on what can we do beyond those immediate responses I mentioned at the beginning about taking food to people. It's the things we can do are about recognising that there isn't a right to food, and that's a national government issue, so we can join in with people like Greta, who's going to be speaking a little bit later, about understanding the national significance and supporting her with national lobbying. We can better understand the circumstance of our residents. So again, echoing Rachel's findings, one of the most significant things for us was recognising that of the 506 clients of our debt advice service last year, 36% had unsustainable budgets, even after receiving advice, because there's often an idea perpetuated that the problem is navigation or joining up services rather than just absolute poverty. And being able to test and understand what is the problem helps. So we, in that case, found that the issue is absolute poverty. So that becomes a bigger challenge. The local authority has a convening right. We bring partners together. We have a food poverty network in Newcastle. We can map provision and we can try and build consensus. We can target support. So last year, there was around £28.6 million of additional benefits secured through welfare rights advice, the best ever summer schemes, providing food and activity for children who, well, all children, but particularly responding to those children who would have free school meals but wouldn't have got them during the school holidays. We can change policy. So in July, the council adopted a policy of having no evictions into homelessness. Since 2008, we've reduced evictions from our 26,000 council homes by 75% by providing advice and support to help people cope with the consequences of poverty. We can align our provision, so we have a multidisciplinary team that responds to those families with the greatest levels of disadvantage. And I suppose finally, we can work with organisations like academics and universities to try and realise opportunities to maximise the value of our collective investment. We see that there's a massive read across with health inequality, but health isn't democratically accountable locally, so we need evidence to demonstrate the value of working more closely to reduce the health impacts of poverty. We would really like to work with academics to help us translate the kind of findings that Rachel was presenting there into real-time systems. And lastly, again echoing Rachel's point at the end, that we need to work to transition and help those residents as the coronavirus pandemic, hopefully after a vaccine, as we change into different systems, that we've had an additional 14,000 residents since March go onto universal credit. So we want to help and support those residents transition without being affected by food poverty, and particularly in terms of BAME groups, refugees. Newcastle has a large refugee population and they've been most adversely affected. So it's managing those transitions. Those would be the three areas that we would like to see organisations like Fuse concentrate some of their energy on.
Thank you,
so,
Neil.
Thanks.
No, thank you. I think that was lots and lots of points that we need to think about, and it would be good to bring those up when we have an opportunity for the question and answer session. So you've set us all some good challenges and some very important challenges.
Thank you.
Yep, and it gives me great pleasure now to welcome Greta. Greta, as many of you will know, is based at Northumbria University. And while Greta gets her slides up, can I just remind everyone to use the chat function to start putting questions there for the session. Now, these are very brief sessions. They're 5 minutes, and I'm going to time them and be as strict as I can with timing. So over to you, Greta. Thank you.
Okay, Amelia, can you hear me?
Yes, I can, Greta.
Okay, and can you see my full slide?
Yes, it's beautiful. Thank you.
Oh, fantastic. Okay, so first of all, apologies to anyone that thought I was going to be talking about holiday hunger and the new government funding for holiday hunger. I'll talk about that some other time, but today I wanted to talk about food insecurity and the lived experiences of HE students. And there's a number of reasons I wanted to talk about students, is that often I think they're a forgotten population, although as academics we come face to face, or at least online now, with students on a daily basis. Furthermore, these are young people that are often living away from home and therefore don't always feel fully integrated into the community to which they've moved. So Neil is talking about some of the services that are on offer. Our early study that we conducted shows that students weren't aware of many of those services and they don't appear in data. And finally, with the widening participation of students in engaging and entering into HE, which is great, there's also been a radical shift over the last few years of the increasing number of students relying on part-time employment to finance their studies and their cost of living. So without further ado, because I've only got a few minutes, I'll give you a brief shot of what we've been doing and then explain it in a bit more detail at some other time. So during April, the month of April this year, we decided to conduct a pilot survey across 3 universities, and we actually had quite a good response rate. We had 1,234 students that completed the full survey. And in our survey, we used the full USDA household food security module, and we also collected data on their health and well-being. So we collected data on their physical health, but also on their mental well-being, their diet and any changes in their dietary intake, their finances, their living arrangements, and also their access to teaching and learning. So this is just a really quick shot because I know that time is really tight. So when we look at food insecurity, I think what's really interesting here is that whilst 49% of all the students reported that they had a high level of food security, and this is relating to what Rachel was talking about earlier, over 15%, just about 15.5% of students had marginal levels of food insecurity, suggesting that they face some problems accessing food during the COVID lockdown. This was during the initial lockdown. And 17% of university students experienced low levels, and a very similar number, very low levels of food insecurity, meaning that sourcing food for these students during the COVID lockdown was a daily struggle. And I think this level of food insecurity is striking and is likely to impact on students' cognition, their development, mental health, and most importantly, their academic performance. And I've put there just one of the qualitative quotes from one of the students. And the student said, "I'm shopping on a budget and eating cheap and unhealthy food." While another explains, "I don't have enough money to feed myself." And I'll just present on our final slide. We then looked at the predictors of food insecurity. Okay, and we have many of these, but there's just too many to present. So you can see here that students that either, if you look down at the top line here, as we go 3 columns along, I don't think you can see my mouse moving, but it's this one here that I'm focusing on here. Students who return to live with their parents or are actually living with their parents and other adults have quite a good percentage of high food security, and likewise for those living with a spouse or partner. However, these experiences of food insecurity stand in sharp contrast to those students living alone, as indicated at the bottom here. So if you look at those students living alone, you can see that 32% experience very low food security. And this includes postgraduate accommodation, where whilst they may be in a block of rooms or studio apartments, they consider themselves as living on their own. And it's important to note that students residing with other students, so that the 3rd column along in the bottom row, that this doesn't actually protect them from also experiencing low levels of food insecurity. So I won't go further than that, only to say that we are using different models to look against predicting food insecurity on gender, ethnicity. We're finding probably very similar results to Rachel. And we've just recently completed a national survey that was just done during the complete rise in student cases of COVID-19, when students came back to university in the fall term. And those data should be available within the next 3 weeks. So thank you very much.
Thank you so much, Greta. I'm right to time. That's wonderful. Just while Heather Brown is getting her slides up, I'll introduce Heather. Heather is co-lead of the Health Inequalities research theme for Fuse, and Heather is based at Newcastle University and is a health economist by background. And Heather, we've got five minutes and looking forward to hearing your presentation. Over to you, Heather.
Thank you, Amelia. So I'm briefly going to talk about some joint work that I'm working on with Viviana Albini, John Wildman, and Susanna Mills, who I think are all on this call as well. So what we do is we looked at the demographic and economic factors that increase the risk of reporting food insecurity, similar to what Rachel did. So I won't discuss those since I only have 5 minutes. And then we also look at how increased financial vulnerability and social support influences the likelihood of low socioeconomic families reporting being food secure, to identify some of the mechanisms which might have explained food insecurity during the COVID-19 pandemic. And I will focus on those results. So just a brief description of the data we use. So we use data from the Understanding Society COVID survey. So this is an offshoot survey of a larger household survey of 40,000 people. So everyone who participated in wave 8 and 9 of this survey were invited to participate in this COVID survey, and approximately 14,400 people agreed to participate. And we look at 3 questions related to food insecurity, specifically if any person in the household is unable to eat healthy and nutritious food, hungry but did not eat, and that's over the last 4 weeks, as well as used food banks in the last 4 weeks. And firstly, we use logistic regression just to look at the characteristics associated with food insecurity. As I said, I'm not really going to talk about that today. And then we look at a decomposition approach to determine how much financial vulnerability and social support explain the likelihood of reporting 3 measures of food insecurity. So I will skip over these because it's very similar to what Rachel discussed. And then I will just look at the mechanisms. So we defined being financially vulnerable as being behind with bills. And so that explains 51% of the likelihood of people with no qualifications reporting being food insecure, and 49% for those with basic qualifications. And families having access to free school meals explains 37% of the likelihood of people with no qualifications being food insecure, and 28% for those with basic. And for going hungry and not eating, we find that being behind with bills explains 31%, and 44% for those with basic qualifications. And access to free school meals explains 11% for those with no qualifications and 13% for those with basic. Or being on furlough explains 16% for those with no qualifications, and receiving help with food with childcare and food from grandparents explains 5% for those with no qualifications. And for food bank use, we find that 15% of the likelihood of being food insecure is explained by being behind with bills, and 17% for those with basic qualifications, and 25% of the likelihood of using food bank is associated with free school meals for those with both no and basic qualifications. So what this all means is that financial vulnerability explains approximately half the likelihood of being insecure for those with lower socioeconomic status measured by educational attainment, and access to free school meals, being furloughed, and receiving help from grandparents explains approximately 30% of the likelihood of being food insecure for those with lower socioeconomic status measured by educational attainment. And just to make sure that I am in time, I will leave it there because we have some recommendations on how we can reduce the likelihood of food insecure given the mechanisms we identified. Thank you.
Very the opportunity to ask questions. I can see that the hopefully in the question and answer session. Next have Dr. Steph, also from new lead of the Fuse research, is Steph, who has organised along with Heather and other members of the Complex Systems and Health Inequalities programme this meeting today. So I will pass over to Steph. Are you able to share your screen, or is it just taking its time?
It's taking its time. Give me just a tick and it'll be right with you.
Okay.
Like I set bite-sized presentations and made everyone go at rapid speed, so I'm really sorry. I am going to go as quick as I can. Can everybody see that? Because I'm working on 2 screens, I think it does it where you can see the notes and stuff, so I'm really sorry, but hopefully everybody can see that. So yes, I'm going to spend...
It seems like it's, there we are.
Brilliant. Okay, so I'm going to spend the next 5 minutes talking about something entirely different. And I'm going to talk about a project that's still ongoing at the moment that focuses more on community aid responses, that includes food aid. And it's a partnership project with Fulfilling Lives with their peer researchers at Newcastle and Gateshead. So just to give a little bit of a background, we were interested in the responses that local communities and regional communities had to the crisis. And one of those responses was the setup of mutual aid groups. Now, mutual aid is not necessarily a new term. It has roots in things like Narcotics Anonymous and recovery groups, things like Alcoholics Anonymous, that kind of thing as well. But the latest definition of mutual aid, which is offered by the COVID mutual aid support website, is the idea that a group of people can organise to meet their own needs outside of formal frameworks, and by definition, that is a horizontal mode of organisation where individuals are all equally powerful. And this isn't about saving people, but about people coming together in a spirit of solidarity, perhaps in a crisis, to support and look out for one another. And what we were interested in when we set about doing this project is we wanted to see how communities possibly had mobilised themselves to deal with food crisis and the need for increased levels of food aid. And I'm not going to go into levels of food insecurity because I think that's been well covered in other presentations. There's been a small amount of academic research conducted to explore growths in mutual aid, but it's still quite a growing field. So there are other academics at Newcastle University who are doing oral histories that focus specifically on mutual aid groups. I think there's also some work that's just gotten started around volunteering at Northumbria and another project at Teesside. But we were particularly interested in how models of pandemic aid could link to food crisis management in local communities. So in partnership with Fulfilling Lives Newcastle Gateshead, and with a tiny pot of money from the Catherine Cookson Foundation, we've set about working on 3 very, very small scale work streams. The first part is co-production workshops with experts by experience, and that focuses on how people have perhaps experienced community aid. We've conducted one of those workshops, and the second one's on Friday, and we're in the middle of designing a piece of research with their experts by experience to deliver out into their own social networks about experiences of community aid. The second part, which is what I'm really going to focus mostly on now, is interviews with those who have organised or played a significant role in community aid. And the third part is a social media analysis. We think of a sample of Facebook groups of mutual aid groups. Our study deliberately expands the concept of mutual aid. So we've decided that we might better define what we're exploring as community aid, because we've expanded out from just looking at mutual aid groups to also look at other groups that are offering food aid or community aid during the pandemic. And our overall aim is to explore how communities in North East England have mobilised to tackle food insecurity through community aid or mutual aid groups. So just to present really briefly some of the ideas that are starting to come out of our analysis so far. So we, sorry, I put 2 of 4 co-production workshops. We've only done 1, the next one's on Friday. And so far, 9 of our interviews have been conducted. They're quite lengthy interviews, and the average length is about 62 minutes. We're still collecting data, we're still doing analysis, and those interviews with people involved in community aid are a combination of Zoom and telephone interviews. Importantly, all of our interviewees so far are all over 40. Most of them are over 50. We've got a slight oversampling of female people involved in community aid. Now that seems to reflect traditions and volunteering during the crisis, but we've put specific alerts out for anybody under the age of 40 or any men who are involved in community aid groups to come forward and chat to us, and we've had some really good responses to that. And as I've said before, not all of the people we're speaking to are involved with conventional mutual aid groups. And I guess the key thing to point out that we've seen in early findings so far is that food is central to almost all of the aid that our interviewees have described. But the caveat to that is that many participants have emphasised that food is just one visible facet of poverty and around the aid that needs to be delivered in their community setting. And I'm just going to quickly, really briefly point out 3 initial themes, just to highlight that the interviews that we're doing are being conducted by me, but also one of my undergraduate students, Imi, who I think is on the call today as well. So these are the themes that we've had some time to discuss so far. So we deliberately set out to try and explore gender in our interviews, both in the receipt of community and food aid, but also in the delivery of community and food aid. And what we're tending to see so far is that it's not necessarily that there's a divide and that men have not been involved in community aid, but that men and women appear to do things differently. And that's my participants' words, not mine. So what we're tending to see is that in terms of organisation of mutual aid, we're tending to see women taking the forefront of that. But actually what our participants are telling us is that if they needed something, it's not that men are not necessarily participating in community aid, but not necessarily always involved in organisation. The other key thing that's coming out of the study so far is really relates to the idea that this is about more than food. And without question, pretty much every participant that we've spoken to has emphasised how important a sense of community has been to the establishment of community aid and mutual aid. Many participants have suggested that there needed to be a pre-existing sense of community. It was described as essential in some of the interviews that I did, definitely. Those who were interviewed and participating in mutual and community aid were often very, very embedded in their own community. Many participants described networked community aid, and it's part of the reason why we expanded out from just looking at mutual aid. And that often what we saw is a real network of community aid taking place. So we had mutual aid groups, voluntary sector organisations, community hubs, and they were all kind of networked together, often with their local food bank. And that importance of community was felt to be particularly important in the Northeast. All of the interviews are in the Northeast, so I guess we wouldn't expect people to say much different. But I think this is important to point out because the north of England has been highlighted to be the hardest hit by the pandemic. And just to point out, one of the ideas that's coming forward is that we have a certain tradition in the Northeast where you almost have to unify against adversity. And then finally, this has come out of our co-production workshops, but also all of our interviews, that there is often a recognised hierarchy of need when it came to community aid, and this often was a source of tension, particularly between different mutual aid groups. So I guess the question there is who should and should not be supported, and should there be anyone who shouldn't be supported? One of our interviewees suggested that she'd spoken to a different mutual aid group who were not willing to support anybody who was in employment, whereas her perspective was that everybody needed to be supported regardless of that, if they needed that support. Our co-production workshops are highlighting that there are still groups that fall through the cracks, such as those who are in recovery, asylum seekers, and those experiencing multiple severe disadvantage. And that really maps onto some of the things that both Rachel and Neil pointed out in their presentations too. I'm going to stop there. Hopefully I'm on time. Amelia, have we lost you? Okay, I might have to take over as chair if we've lost Amelia. Would that be okay?
Yes, I think if you go ahead, I think.
Okay, in that case, I will stop sharing my slides and I'm going to pass on to Eimer, who's going to tell us a little bit about the work that she's been doing.
Hiya, I'm Eimer from FareShare Yorkshire. I'm just getting my slides up. Is that okay?
Perfect.
Okay, so thank you so much for inviting me to speak today. So I'm Eimer Brown, the Development Officer at FareShare Yorkshire. So a really quick overview for those of you who don't know much about FareShare. We redistribute surplus food, completely edible, all in date, from all across the food supply chain. So that's manufacturers, hauliers, logistics, and the supermarkets as well. And we redistribute it to our really large network of charities and community support groups. So school breakfast clubs, food banks, community groups, soup kitchens, elderly lunch clubs, and all of these really great organisations are known as our community food members, or CFMs. So how did we mobilise during the pandemic? So as you can see here, we'd always expect a small period of growth as we try and harness more surplus food and redistribute it to more and more really great community organisations who can help more people suffering from food insecurity. And then you can see it, once lockdown hit, the tonnage of food redistributed by us skyrocketed. So this graph here is showing food redistributed by FareShare Yorkshire. So that covers South West and North Yorkshire. So the tonnage of food we redistributed skyrocketed during the pandemic to a peak here in July, which was 3 times what we were redistributing in January. And comparing to January, because we often see a dip off in February anyway, as we provide a lot of schools and they don't receive any food during half term. So how did we manage to do this really increased distribution? With the help of DEFRA, they provided us with £10.5 million of funding to buy food at cost. So through Sainsbury's, Asda and XPO, we were able to buy this food, store it and transport it. And this was food that we wouldn't normally acquire as surplus, so tins, pasta, ambient goods, whereas we more distribute things that fresh foods, meats, fruit and veg, dairy. So with all this extra food, most of our CFMs started acquiring more food from us as they had increased demand. So for example, one of our CFMs in Sheffield Food Hall, the week of lockdown, they fed 34 people. And then a month later in April, when you can see things have really started to rise here, they fed 353 people. So it's a really dramatic increase in the food redistribution of each CFM. We also found that we took on a lot of emergency CFMs. These were hyper-local, recognised a need in their local area and operated mainly food parcel delivery services. They often didn't have a referral system in place. It was more anyone who needs the food can have the food. We're now at the situation where we're questioning, is this a new normal? Because we've seen a decline here a bit, but we're still, when we were distributing 3 times as much as normal here, we're now distributing 62% as much as normal here. And we're asking, is this the new normal and is this sustainable for us? And why hasn't it got down any further, really? So I think the explanations for why we haven't seen a further increase, which I think is what we were expecting, a further decrease, sorry, which I think is what we were expecting, is COVID-19 increased need for emergency food provision, not only on the short term, but also on the long term, just like Rachel was saying. And again, that COVID-19 maybe highlighted need that was already there. For example, with Marcus Rashford and the holiday hunger campaign, it's not that there were never children who weren't receiving food during the holidays before, but the light was shed on it during COVID. And with our extra DEFRA funding, extra fundraising, we were able to help address this need. But that need now hasn't gone away because it was always there. And then finally, and this is the question we're really asking ourselves, is was any of the need perhaps supply driven rather than need driven, particularly with these new emergency CFMs that we took on? We found that a lot of our existing CFMs, the amount of food they're redistributing has gone down to almost back to January, February levels, because they have a robust referral system in place and they're seeing who's in need for crisis food. And if the people that are coming to them aren't in need of crisis food, they are moving them along the food ladder. So they're still getting support, but it's a different kind of provision. Whereas these emergency ones that we took on, they're giving out exactly the same food and they're not asking any questions. And once food's given without referral, it's hard to then ask those questions. So where do we go from here is really our question. And I think what we would like to see is maybe an introduction of more food pantry type models. What this would allow is, from our perspective, we could give out more fresh foods, whereas food banks and emergency food parcels are taking ambient goods. If we're giving out fresh foods, meat, dairy, fruit and veg, this is the food that's often surplus. And so that's a lot easier for us to give out and it works better with our business model. It's better for the environment. and that's the food that we tend to get in. And we'd also like to see a more robust referral system for some places, or adhering to food ladders so that everyone's getting provision and everyone who needs support is getting it, but there's different stages to help people make that jump from crisis to just shopping in Tesco. So thank you very much.
Thank you very much, Eimer. Sorry, my internet dropped. Richard, if you're ready, please, to share your screen for our last bite-sized session. That was fascinating, thank you. And our final bite-size of what's been a really fascinating morning is Dr. Richard Lee from Northumbria University. Over to you, Richard.
Thanks very much, and thanks everyone for some really fascinating and interesting talks. Hopefully my brief presentation is going to connect to that. I'd just like to speak briefly about a new research project that I'm beginning with colleagues Pam Graham and Kate Hackett from Northumbria University. And this is funded by the British Academy Leverhulme as part of their small grants scheme. And the title for the project is Between Transition and Crisis, Food Assistance Organisations in Northumberland and the Implications for Social Infrastructure. And I just wanted to explain some of those terms that we're using and kind of what the project is all about. So the project has come about from long-standing research interests that we've had in the food system, work we've been doing with master's students over the last few years about food assistance and emergency food aid provision. And a pilot study that I undertook at the start of 2020 with managers and coordinators of food banks and food assistance organisations to try and understand what was happening as services were beginning to mature and diversify in Northumberland. So when we talk about transition, we're interested there in the transition of service provision and activities. Some organisations are still focused on perhaps a rather transactional model of food aid, while other organisations in Northumberland are looking to diversify their activities into more community development activities and forming part of what Steph was talking about in terms of networked community activities. But this is all happening, of course, in a series of interlocking crises, and I think it's important to call them crises, but also reflect on the fact that they're partly brought about by political choices and political decisions that have been made and actions that have been taken. And we can think obviously of austerity and the kickstart of austerity policies into the steady proliferation of the need for food aid and food assistance when it didn't previously exist. Obviously the impact of COVID over this last year, which is what many of us are talking about. Got uncertainty over Brexit and the implications down the line, and of course climate change, which is a very significant challenge across all of society. But in terms of this study, obviously we can't tackle all of that, but that's an important context. What we're interested in is the ongoing adaptations and strategies that food assistance organisations in Northumberland are deploying, and strategies that the local authority, Northumberland County Council, are deploying in an attempt to try and strategise and coordinate the activity that's happening across individual organisations. And to do this, we're taking a longitudinal approach. And an advantage of a longitudinal approach is you can track change over time, and you can also build a research relationship with organisations. So some of the organisations that are going to take part in this study took part in the pilot study that I conducted with the support of Northumbria University and my department to do some initial building towards the study. So in terms of a longitudinal approach, what we'll be doing is serial semi-structured interviews with food bank managers and coordinators. So an initial interview, 6-month interview and a 12-month interview to try and track change over time. The impetus for this study was pre-COVID, but obviously COVID has changed things significantly in terms of some of the activities of food organisations, and we've seen all the excellent talks, the kind of broader impacts when you look at the data as it was presented by Rachel, and then when we look at the examples that other people have talked about in terms of how that's impacted upon what organisations have done. From some of the interviews that I've done as part of this project early on, we can see diverse responses based on need, but also based on the demand, the ambitions of the organisations. So, for example, a food bank in South East Northumberland, developing its facilities, actually quite cash rich, but in response to COVID has seen a significant increase in demand, as Rachel pointed out in her talk, of families with 3 or more children. turn to look at another food bank in the north of the county. They've had a tenfold increase during the COVID period as well in demand, but that's come more from single people and couples, and that's a combination of people who've now got job insecurity, lost their jobs, or have got mental health issues. So we can see we've got diverse organisations with diverse ambitions, but we've also got diverse need across even just a county like Northumberland, because of course we recognise there are significant between region inequalities in the UK, but there's also significant within region inequalities if you think about the North East, and then even with a county like Northumberland there's significant inequalities. So, you know, median income in Ponteland is £50,000. Median yearly income in Ashington and Blythe is £22,000. That was pre-COVID, so we can only imagine what the differential might be now based on people's precarious employment. And that maps onto kind of the variation in the county of existing local cultures of solidarity and mutuality and support. So again, speaking to some of the things Steph was talking about, but what we've conceptualized those as elements of what we call social infrastructure. So that exists along with and alongside existing services. So if we think about traditions of solidarity and mutuality, some of that comes out of mining communities. Some of that comes out of interaction with mining communities, in organisations like the Salvation Army. We've got a long-standing role in mutuality and support. So in terms of the research questions that we're interested in addressing in the project, these are some of them just to give you a flavour. So some of it's a little bit of a mapping exercise, but we're not proclaiming that this project is going to map every sort of activity in Northumberland. Okay, we're focused primarily on food banks and emergency food assistance, but we're still working through our purposive sample about the types of organisations we might include. We're particularly interested in how these organisations relate to local authority. So in Northumberland, Northumberland County Council has developed a food partnership, which has just got up and running, partly as an attempt to try and strategise some of this activity. So we're interested in this relationship between these diverse organisations and the local authority and where this is going, partly with one eye on kind of local governance arrangements. What do the managers and coordinators kind of view as future challenges? Well, we're already starting to talk to them about how they've responded to COVID. And as I said, this project was in fruition pre-COVID. One thing that came out of earlier work that we did with master's students was this notion of a sticking plaster that managers and coordinators talked about. So they used that term themselves separately. 4 or 5 respondents used that term. I realised the Trust will trust as well and made mention of that term a few weeks ago. So do managers and coordinators in Northumberland think that what they do is a sticking plaster? If not, why not? If so, what are the key issues they think should be they need to be addressed? And there's a diversity of opinion, there's a diversity of politics, both between organisations and within organisations, about what they see as being the underlying reasons for food insecurity and poverty and what they think should be done about that. And some food banks have been placed in quite difficult political situations over the last year or two, which is interesting. And then speaking of what Neil was talking about, the role of the state, what do these different organisations think the role of the state should be at all different levels? And again, we've got a diversity of views from organisations whose managers and coordinators want a high degree of autonomy to those that are prepared to develop these relationships. So I'm going to stop there. I've probably been talking long enough. The approach we're taking to trying to understand this is drawn on from what's called transformative social innovation perspectives, and I won't say too much about that now, but if anybody's interested in talking further about that, I'm more than happy to do so. Okay, thank you.
Thank you very much, Richard. That, again, another fascinating presentation. I'm sorry that they've been so short. We've been trying to cram a lot into this morning,